Good morning, and thank you for having me speak to you today about my education, my career path, and where I am today and what I do. So, my name is Dr. Shelina Babul, and I wear various hats. I'm the Associate Director of the BC Injury Research and Prevention Unit, which is located at BC Children's Hospital. I'm a Clinical Associate Professor in the Department of Pediatrics at the University of British Columbia, and I'm the Director of the CHIRP program, which stands for the Canadian Hospitals Injury Reporting and Prevention Program, which is at Children's Hospital. And I'll tell you a bit more about each of those roles as I continue in my talk today. So I was asked to speak to you today about how I came to be in the positions I am, what was my career path and my educational path that I followed, and what I do in my daily life. So let's just start with what I did for my education. So I have a PhD in hyperbaric medicine. I did an undergraduate degree in kinesiology or human kinetics, a master's degree, but then I was given the opportunity to transfer my master's degree into the PhD program. I've always had a love for medicine, and I've played competitive sports my entire life. So I wanted to mesh the two together and to build a career and a pathway in which I could do something good with both those areas. And that's why I went into hyperbaric medicine, specifically focusing around sports-related injuries. My career has really evolved. I started off being a research assistant working at BC Children's Hospital 25 years ago. And as I was going through school and finishing my school, my position kind of evolved. So I'm a bit of an anomaly in that I've stayed with the hospital for the last 25 years, but my positions and my roles have evolved as my academic experience and my educational experience evolved. So I went from being a research assistant to a research coordinator to then completing my PhD and delving into the positions that I currently have. So that's typically my education that I did. I did them all at the University of British Columbia. And I have to say that UBC is a fantastic academic institution, primarily in the Faculty of Medicine. The academic investigators, the teachers, the professors, the program itself are really highly respected and really highly valued. So what do I do in each of these roles? Essentially, let's start with the BC Injury Research and Prevention Unit. I'm the Associate Director for that unit. Injury prevention is the leading cause of death and disability for ages 1 to 44. Now, 25 years ago, if you told somebody about injury prevention, they would say, what is that? And if you think about it, 90% of accidents are preventable and predictable. They aren't actually accidents, so to speak. Accidents kind of make you think that they were unavoidable and they just happened. But certain injuries are avoidable if they are, if you take the right preventative measures to take measures to avoid them. So, for instance, riding a bicycle. If you're riding a bike, wear a helmet, because if you fall off that bike and you hit your head, likely you're to sustain a brain injury, ranging from a concussion, which is a mild traumatic brain injury, to potentially a severe one. And we've seen people unfortunately die from hitting their heads on the cement. So injury prevention looks at the life cycle, all ages, and injuries related to the life cycle. So falls, poisonings, drownings, motor vehicle crashes, intentional injuries such as suicide, domestic violence, and we look at trends and patterns, and we provide resource and information to establish policy and practice to reduce those injuries from happening. So I'm the Associate Director, as I said, of that program at BC Children's Hospital. The second hat I wear is I'm a clinical associate professor in the Department of Pediatrics, Faculty of Medicine at UBC. And my area of research focuses on concussions and traumatic brain injuries. I've been in that field for about 15 years, and my main focus is really to standardize recognition, diagnosis, treatment, and management of concussions. It is imperative that everybody understands a concussion is not just having your bell rung. It's actually a very serious injury, and that needs to be addressed, recognized immediately, managed, and diagnosed accordingly. So I've been in that area, as I said, for 15 years, and my goal is to standardize care around this injury amongst various audiences. So, for example, physicians need to know how to diagnose and manage a concussion accurately. The science around this injury is changing rapidly. Before you were told you had your bell rung, it's not a big deal, don't worry about it, you'll be fine. Then you were told, okay, if you've got signs and symptoms, go into a dark room and don't come out until your symptoms subside. Then it was, okay, you know what, if you have signs and symptoms, don't go into a dark room, just don't do any activity until your symptoms subside. And now the latest evidence is showing us that, okay, if you have a concussion, recognize it immediately, be seen by a medical professional, be diagnosed with a concussion, and then stop physical and cognitive activity for a maximum of 48 hours. And after that, slowly, very slowly and progressively, integrate back to normal activity, baby steps, if you will. And the reason for that is you don't want to do too much too fast. So when you have a concussion, the axons and neurons in your brain are sheared and torn. It's kind of your information highway to your body. And I'll give you an example. If you're in rush hour, you're bumper to bumper going along the highway or through the tunnel, versus if there was no rush hour and you could just speed right through. That's exactly what's happening when there's an impact to the head or another part of the body that's causing the shearing and tearing of those axons. And it needs a bit of time to reset and re-heal, so to speak, so that the information can progress through as it would normally. So your brain, as I said, is the information highway and has millions and billions of neurons and axons that transmit the information to allow you to see, to talk, to hear, to walk, to eat. And it really is the only organ that cannot be transplanted. So you really need to take it seriously and protect your brain. So, for example, wear a helmet if you're participating in recreational activities such as riding a bike. Wear the protective gear when you're playing sports, if gear is used in that sport. So going back to 48 hours of rest, this allows the axons that are sheared and torn to really reconnect so information can get through as it would normally. And then what you have to do is follow a 6-step graduated return to sport, return to school, return to activity, return to work protocol. And all this information is available on a website that we've developed that's used at a national level. It's called the Concussion Awareness Training Tool. The acronym for that is CAT, C-A-T-T, and the website is catonline.com, CATTonline.com. That website has all the relevant information depending on who you are and what lens you bring. So if you're a medical professional, you need to know different information than you would if you're a school professional or a teacher or a health worker dealing with domestic violence or a high-performance athlete, say for instance. So we have built this tool that provides e-learning modules for various audiences, as well as relevant, up-to-date, evidence-based resources. If you Google concussions, you'll get millions of hits. So how do you know what's the most credible and what's the most evidence-based and accurate? Before we built the tool, what we did is a bit of an environmental scan to say, does something exist out there to inform individuals? And if there was something that existed, what were the gaps? Second, what we did is we conducted focus groups with all these various audiences to say, if we build something for you, what would you want? So, for example, the physician said, we want the most amount of information in the least amount of time because we are so busy keeping up to date with every other ailment and the guidelines around treatments for all those injuries and diseases that we want something that we can refresh our minds quickly and easily. Parents said, we want the most amount of information in one concise, succinct place where we can go and we know we're getting the best information. Teachers said, we want to know how to support our students integrating back to academics or how to support them if they sustain an injury in the school environment. So that's what we took all this information and we built the Concussion Awareness Training Tool. The tool is being mandated by over 40 schools and sporting associations across the province and across the country. It's really building its momentum. All the tools have been evaluated to show there's value in building this resource. You know, hundreds of thousands of dollars have gone into building and maintaining this resource with funding from our provincial government, from the federal government, the Public Health Agency of Canada, Child Health BC, and various other organizations. So, is the money well spent? So we evaluated it, and it really showed that for those individuals who took the training, whether you're a medical professional or a teacher or a parent, it really changed your knowledge, attitudes, and practices around this injury. And that is vitally important because you want to know that it's really making a difference. We're trying to really raise awareness and education so that people understand that if I have a concussion or a potential concussion, I know what I need to do, what signs and symptoms to look for, when to get checked, what some of the red flags are in terms of when I should go and seek 911 immediately. And in terms of managing my concussion, how can I self-manage this injury over the course of my recovery? The good news is 85% of concussions resolve uneventfully, but you do have 15 to 30% of individuals who experience persistent concussion symptoms. So they really need to know how to deal with this injury, who to seek in terms of healthcare professionals. So for instance, if you have persistent dizziness, headaches, you probably want to see a physiotherapist who knows how to treat those persistent symptoms through something called cervicovestibular therapy. If you're having mental health issues, who you can seek support and help from, such as a neuropsychologist or a neuropsychiatrist, as a few examples. The third hat I wear is that I'm the director of the CHIRP program at BC Children's Hospital. And again, CHIRP stands for the Canadian Hospitals Injury Reporting and Prevention Program. So what we do is we take all injuries that come into the emergency department and we look at that information per individual and monitor trends and patterns. So to give you an example, a few years back, there were these shoes that were on the market called Heelys. And what it was a running shoe that had a built-in wheel to it. And if you kicked in your heel, the wheel would come out and you could glide along the path that you're walking. And we started seeing spikes in injuries of kids wearing Heelys, from head injuries to broken bones. And we developed messaging around safety of using those heelings, and it also helped us develop policy and practice with our local government to try and minimize this injury and what preventative measures you can take to prevent injuries. So for the CHIRP program, we monitor all injuries that come in from poisonings. We recently did a cannabis study looking at cannabis-related poisonings prior to the legalization of marijuana in October 2018. And what we found is that the average age of cannabis poisonings was 15-year-olds who were using cannabis and mixing it with other substances, primarily alcohol. 71% of those cannabis poisonings came in using cannabis and alcohol together and at a private residence, primarily at their own residence or their friend's place. So what we try to do is, again, develop policy and information related to those injuries to minimize that from happening. So in my daily life and daily practice, I try to juggle and balance all three of those areas. But again, primarily concussions is my key injury that I see, as well as other sport-related injuries. But what I do is I ensure that the individual is assessed accurately, diagnosed, and given the right information that they need to support their recovery. And we're available to answer any questions and help support that individual through their trajectory of recovery. So through the work that I do, I work closely with our provincial government, with national collaborators across the country in similar areas, as well as the Public Health Agency of Canada, Parachute Canada, which is a national injury prevention NGO for the country, and the BC Centres for Disease Control and Injury. We develop health strategies, injury prevention policy and practices to really work with public health to make British Columbians safe. So I hope all this information gives you a bit of flavor of what I do in my daily life. I want to thank you for inviting me to present to you today, and I wish you all the very best success in your future endeavors, and primarily in medicine. Whatever walks of life you go through, I wish you every success. Thank you.